Good afternoon. Welcome, and thank you so much for joining me. Thank you so much to Leading Age for this opportunity and for this great conference. Today's presentation is about aging together, and it's really one of my favorite things to talk about. I will share our mission statement and a formal presentation, but I'd like to start by describing what Aging Together is. We are a small nonprofit agency that represents a collaborative effort with over 150 partners, in fact, um, throughout our entire region. And we are not an area agency on aging. A lot of people think that we are a small area agency on aging, but in fact, we're not. But we work very closely with our area agency on aging. And in fact, Aging Together came about in the year 2000 because of some very forward thinking individuals who actually worked at the area agency on aging. So, the learning objectives for today, participants will gain an understanding of a model for connecting older adults to community resources. Participants will learn two strategies for developing systems change, and participants will learn about a model for volunteer engagement. So this chart really highlights why Aging Together came about in response to the 2000 US Census, where it was reported that the number of older adults coming to the region would be almost double in less than 20 years than it was at that time in the year 2000. The director of the Aging Services AAA wondered if this region was prepared to meet the needs and the preferences of older adults in the region. Um, the Area Agency on Aging also realized that no one agency would be able to do this alone. And so they really invited a lot of local stakeholders to join the, the conversation about were they prepared. So they invited stakeholders from the entire region, which covers the 5 counties in Virginia Planning District 9 of Culpeper, Fauquier, Madison, Orange, and Rappahannock. We cover a total of 2,000 square miles. It's a very rural area, and each county has its own unique and individual culture. It was clear from the beginning that it would be important to have both a local and a regional approach to this question about meeting the needs of older adults. And it was going to be really important to be working sort of feet on the ground in each county with the people in that county, but also taking a regional approach in an effort to leverage resources. So the stakeholders, you might wonder who were the stakeholders that we invited to the table. They included local government officials, hospitals, Alzheimer's Association, social services, law enforcement, older adults, and more. And so it really started with an invitation. And that's how all these people came to the table. So the initial challenge in 2001 was to figure out how to help our localities prepare for this growth. We wanted to be sure that residents had the services and supports that they needed as they aged, and we really needed to collaborate. At this time in our region, there were really very few providers. There was really no choice for home health care, long-term care facilities, affordable housing. There wasn't that much transportation for older adults, even access to food. So we really did not have a lot of providers at all in the area at that time. So the stakeholders and the partners, they decided to collect information about older adults living in the region through an elder needs assessment. And I'll just sort of highlight here that that's a really important first step in terms of figuring out, a plan and how to answer this question. So I think once you bring stakeholders to the table, it's really important, people can think, well, we have an idea of what people might need, but it's um, it's really advisable to invest in a proper needs assessment. And that's what we did. And we asked input from older adults in the area, from caregivers, service providers, and decision makers through a series of community conversations on aging. And in that initial needs assessment, we asked basic demographic information. We asked about health status. We asked what kind of need for supports people had, what services they were currently receiving, how satisfied they were with those services, and what they anticipated their future needs might be. So the voices we heard from and the data from the needs assessment echoed a similar theme across the entire region. So we had this theme of questions or comments such as, my mother has Alzheimer's disease. Is there a safe and affordable place she can go during the day to give us both a break? My biggest fear is being lonely and isolated. How can I stay connected? How will I get to the store or the doctor if I can no longer drive? I don't want to go to a nursing home. Can I get affordable care in my own home? Is there any affordable housing designed for older adults specifically in this area? My husband seems depressed. How can I get help for him? How can I find out what services are available here in my community? So, without going through all the percentages of all the answers to every question, I'm just going to summarize the initial results from, or I should say, the results from the initial needs assessment. And it highlighted a few things. So, the first thing that was highlighted was the value that is added to a community by older adults in terms of their life experience, their skills, their expertise. They contribute a great deal of time and money to support community endeavors, often through volunteerism. They're often caregivers for others and sometimes multiple people. They're certainly a potential workforce. And older adults can really be creative forces and agents of change in a community. So it was very key in our initial endeavors to involve older adults in the community and not for all of the so-called professionals to determine the needs. So the 2002 needs assessment was published. As I was just explaining, it highlighted the value of older adults and the value that older adults bring to a community, but it also highlighted some other things. It highlighted the rapidly increasing need for community services to support elders. And service providers were not meeting the current demand. So there was a lot more demand than there was supply in terms of services in this area. There was an increasing need for care coordinators, guardians, ombudsmen, adult protective services, and other services to help elders access services and transition between care settings. So the many individuals who joined forces under what we called then the Elder Coalition. So all of those stakeholders who came together to the table, we sort of had a name for ourselves before aging together, and that was the Elder Coalition. And they worked through teams in each county as well as regional work groups. So remember, it was very important for us to have a local presence in each county and not to be sort of working from some central location somewhere else far away. And then in 2004, the Elder Coalition was awarded a grant from the Robert Wood Johnson Foundation to engage the full community in creating a plan for the long-term and supportive services development for the region. So again, the stakeholders, the partners included all of those people I mentioned. Those are the people around the table from social services, local hospitals, Alzheimer's Association, faith communities, and many more people, and older adult individuals as well, and any citizens that were concerned were invited to the table. At that time, at the Elder Coalition, we formed a board of directors, and the county teams really began to do some of the work, working at that local level. So in 2006, the Elder Coalition transitioned into Aging Together. And that's a name that we spent a lot of time talking about. And it really reflects that we are all aging and that it takes a community to affect change. Aging Together partners developed a work plan to address the challenges that were identified in that community needs assessment. So that was really our roadmap, that initial assessment. And the plan was built on existing strengths and the existing resources of the communities, but it also had to take into consideration that individual culture in each county. I can't really emphasize that enough. In our 5 county region, each county is really its own animal. It really truly is. And it's very important to recognize that and to not try to do a cookie cutter solution. That's why the teams often in each county would come up with some very different approaches to solutions, because we really did value the individuality of each county. And I think that is really something key. The That initial strategic plan really highlighted um, what we called uh, 6 critical need areas. So there was a need for care options such as in-home care providers, and affordable housing, transportation and adult day support, assisted living, and skilled nursing. So there was a real need for options, and services in the area that I've now mentioned a few times. Um, there was a need for a workforce, and we recognized that a strong volunteer network was needed to help with those identified areas in transportation and home improvement and nutrition programs and more. Another critical area was raising awareness about the importance of health and wellness for quality of life as we age. And that includes health and wellness for caregivers as well. Another key critical area was the need for communication about how to access information and connect people to any of the services that might be available, including regional and local resource guides, which really did not exist at that time. It was critical to maintain a focus on our county partners and the regional coordination as well, for sustaining the Elder Coalition, which is now became Aging Together. So in sustaining Aging Together. And it was also going to be critical for us to ensure additional financial support to continue the work of Aging Together. And we were able to do that through grants. And also, one of the key advantages of engaging local government early on was to get that local government county support. Oftentimes, the counties will be willing to support an organization that's providing services that they should be offering or providing, but are unable to. And to this day, we rely on that county support. I'll talk a little bit more about that later. So a few years later, another Robert Wood Johnson grant was awarded, and it was a pretty significant grant. I think there were only a few people selected across the country, a few agencies. It was in the amount of $750,000, and it was for a focus on sustainable systems change. And matching funds were recruited from local governments and local businesses and some service providers. And by 2013, Aging Together had become its own 501c3 nonprofit organization. And And to this day, this chart illustrates our staffing structure. And you can see that our core leadership and our board of directors, we still have that involvement from those original partners. So on our board of directors is representation from each of the 5 departments of social services. In fact, it's mostly the social services directors that sit on our board from each of the 5 counties. The AAA is still very involved with us. The Regional Planning Commission director sits on our board. We have hospital representation, and we also have at-large representatives. We also still work very closely with our county teams. We're a very small staff of 1 full-time executive director, that's me, and we have 3 part-time people. We have an outreach director. We have a county resource specialist who is really the main person who works with coordinating our teams. She attends all the team meetings. And we also have a volunteer driver coordinator because we have so much more to offer now, which I'm going to talk about in a minute in terms of all of the new services that are available from all the hard work of Aging Together over the years. We still also maintain a regional coalition. So ever since that initial needs assessment back in 2001, 2002, Aging Together has engaged about every 2 to 3 years in a needs assessment. Our last community-wide needs assessment was done in 2018. I think that's really key. It's something I'd like to highlight. It's not enough to just do one area needs assessment because obviously the needs are constantly changing. And so we are really committed to doing these needs assessments every 2 to 3 years. And then the needs assessment is what informs the strategic plan of the organization. So as you can see from this chart, this time around in 2018, we asked people, we sort of did that SWOT analysis, and we asked people what they felt were the strengths in the community and the challenges and the opportunities. And what I'd like to highlight here, without going into a whole lot of detail about the assessment, is that the strengths that we now had in the work of the last 18 years at this point of Aging Together, that we now had some really fantastic transportation programs, and we were able to offer some affordable housing. Many more providers, ended up in the area. But we still have challenges. So even though transportation, for example, was improved, um, it still wasn't perfect. So people were still looking for rides to places other than medical appointments. They were looking for maybe rides to the beauty salon or maybe rides on the weekends, for example. So though we've come a long way, and I will talk about our accomplishments in just a little bit, we still do have a lot of work to do. So our job is not by any means finished. Um, this list really highlights some of those achievements that Aging Together has had over the years. And it's hard to just say Aging Together because it's really Aging Together and all of our 150 partners that come together to affect change. But over the years, we have established a volunteer driver program, and Aging Together now gets funding to have a part-time volunteer driver coordinator to help recruit drivers and coordinate that program. We recently received funding for some coordination for the transportation. So, for example, many areas do have regional transportation, but we did not, and it was very siloed, and there were lots of different moving parts to it. But we were able to receive funding to establish a regional transportation coalition so that we could have a much more coordinated approach to transportation. As I mentioned, service providers have begun to come to the area, really by the droves, in fact. Excuse me. We're very proud of the fact that Aging Together and partners helped to facilitate 2 senior villages models, one in Orange County and one in Rappahannock County. For those of you who may not be familiar with the village model, it's really a neighbors helping neighbors type of model. It's just an incredible way for older adults to help older adults in their communities, with food, with transportation, with caregiving. It's just endless. Um, we also have developed a regional resource guide, the first of its kind in our region. We never had anything like that. So we know a lot of people are not connected to the internet. So this is a hard copy. It is also available digitally, but it's an extensive guide that is more than just a listing, a directory listing, but also has educational information like the 10 warning signs of Alzheimer's from the Alzheimer's Association, for example, or the warning signs of stroke. So it's a real important booklet, actually. It's about 90 pages. We did a lot of first responder and law enforcement training over the years. We helped to facilitate an adult day intergenerational center. We had one several years ago, and that actually closed, but we are getting ready now to launch a brand new adult day intergenerational center in Culpeper. So that was another real need in our region. We actually did an extensive feasibility study, and we're really excited to be able to provide that. We have a couple of signature events that we do each year. One is the Art of Aging Expo, which is really like a resource fair, basically, where we have over 65 vendors and we offer free healthcare screenings and flu shots and information. At our last expo we had, which was in 2019, obviously we did not have the expo in recent years because of the pandemic. Can't believe I'm saying years now, but in 2020 and 2021, we weren't able to have it, um, which in fact was another really good reason to flesh out that resource guide, because we could put a lot of information in that guide that we might have typically had at that Art of Aging Expo. Um, we have something called the 5 over 50 event. We believe it's really important to combat ageism. We take that very seriously at Aging Together. And as part of that effort, we really like to highlight the contributions and the value that older adults bring to a community. So the 5 over 50 event is where we honor one person or one couple from each of the 5 counties. Historically, it's been a big banquet, and we present them with an award and we highlight their contributions to their counties. Again, because of the pandemic, we weren't able to have the live banquet, but we were able to have the 5 over 50 as a virtual event, which, by the way, turned out to be the most successful 5 over 50 event to date. As a Facebook Live event, we had over 400 viewers. So we're really proud of that. Each year we offer a dementia care conference with our partners. We formed a little group called the Dementia Education Committee, the Piedmont Dementia Education Committee, and we do offer a conference every year. We've brought in Teepa Snow several times and other great presenters as well. This year, we're looking forward to, again, a virtual conference. In 2020, we did have a virtual conference with Teepa Snow, and it was really highly successful. We offer monthly educational programs now, virtual. We're very passionate about spreading the word about Dementia Friends, and we offer quarterly sessions. And I'll tell you about our statistics in a little while, how many people we've had come through that program. And we also do Veterans Benefit Summits. We recently had a virtual benefits summit, and we had over 65 people attend that. So that was really successful. This just highlights the invitation to our 5 over 50 celebration. And again, it's something that everybody looks forward to. We've had so much success doing the virtual program because we were able to visit people in their communities, in their counties, and interview them and get that on film for the event. So I think even if we were ever to go back to a live banquet, I think we would still take those films of people in their own communities where they work and live, because that was very powerful, as a matter of fact. And here's our Art of Aging Expo. That was the last one we had live in 2019. So you can see it's a very busy, bustling place. And again, we offer flu shots and healthcare screenings, blood donations, a shredder truck, mammogram screenings. I mean, you name it. It's a really big event. It's held at it has typically been held at Germanna Community College. So for the 2019 to 2020 fiscal year, the impact, the number of people we reached through our programs is listed here. We had almost 600 attendees at our professional educational programs. As I mentioned, we had over 400 views on Facebook Live for 5 over 50. We had almost 700 attendees at the Art of Aging Expo. We have over 1,000 volunteers attending county teams and planning meetings. 75 people connected on Aging Together's information line. Typically, we're not information and referral. We really leave that to the experts, but people do end up calling us, and we do refer them on to the Area Agency on Aging or the Department of Social Services, or wherever they need to be. And we had 194 people become dementia friends, and that was just through one round of sessions. We're now offering this quarterly, and we've had really good attendance. So we're very excited about that. So, like many organizations and agencies, Aging Together really had to pivot to meet the needs and desires that were bubbling up due to the COVID-19 pandemic. So we realized early on we really had to take action. So we immediately formed the regional coalition to meet at that time weekly. So what we did was we were one of the first in our area to get on the Zoom. We got that started. We invited all our partners. We were like, hey, okay, we're in crisis mode here. What are we going to do? What are the needs out there? And we just kept meeting. We kept talking. It was so great to have that community support and to be able to touch base with people. Eventually, after about 3 months, we realized, we were kind of getting into a groove and we didn't really need to meet weekly. So we moved that to monthly meetings. We did realize at this time um, there were so many issues bubbling up in the news, awareness of social isolation and loneliness for older adults. What was going on in the nursing homes was really critical. So in response to that, we did form an advocacy group, and we ended up working quite closely with Joni Latimer, the state ombudsman, um, and in looking at how we could support legislation at the state level, but what we could do to kind of mobilize folks in our local region. So now that we've formed that advocacy group, we're going to continue to do that work, that important work. We launched an iPads for Seniors program where we raised some money, and we were able to get all of our assisted livings and nursing home facilities at least 2, if not 4, iPads. So we wanted residents to be able to connect with older adults, with older adult residents to be able to connect with their families during lockdown. We launched a listening and learning sort of storytelling support group We pivoted to virtual educational webinars, at least one, sometimes twice a month. And those are on topics about activities that you can do at home. How can you stay healthy? Exercise programs, falls preventions, just a ton of different topics. End of life, lots of different good topics there. We created a wish list for activity supplies to help out the long-term care facilities. And then a few months ago, the health district reached out to us and asked if we could get some volunteers to help scheduling COVID vaccines. And so we have actually put out an email to our network, and in about 2 hours, I had over 100 volunteers wanting to help. Well, that was way, way too much for the health department. But from that, we got a small group together, about 10 or 15 of us, to help schedule appointments over the telephone. Um, we also launched a home care companion pilot program in Rappahannock County, and that was in response to the increase in elder abuse and neglect that was happening during the pandemic, and a way to support in-home caregivers during this time. So here's a lovely picture of a resident in one of our local facilities connecting with her daughter with one of our iPads. So I'd like to just do a very brief case study just to kind of highlight how all of the services and systems that we help to get in place impact one family, just as kind of a real world example. So Kathy is in her early 50s. She's married. She's the mother of two teenagers, and she works full time. She cares for her mother, Bonnie, who lives with the family in Culpeper. And Kathy's starting to get worried about her mother, and she's just a little concerned about what's going to happen next. When Kathy's father-in-law developed Alzheimer's, this was several years ago, they faced a lot of challenges in trying to find help, and she's really nervous about, going through that kind of stress and anxiety again. So one of the biggest issues facing Kathy is that she wanted to really make sure that her mother had the financial resources that she needed and the legal paperwork to address Bonnie's needs and wants. Her father-in-law, again, he didn't have anything in place, and it was really stressful. She did not want to go through that again. Well, Kathy attended the Art of Aging Expo a few years ago, and she learned about an upcoming training for caregivers that was sponsored by Aging Together. And she saw that one of the topics was going to be, how to get your legal and medical powers of attorney and all that paperwork in order. So at the caregiver training, and the way the training was set up was we actually had round tables, and we had topic experts at each round table. And the participants of the caregiver training, they just were able to rotate around to each table to get information. So they were able to have a little bit more of a conversation and support from others in the same situation as they were. So at the training, Kathy met several other families who were in the same situation as hers, and that was really reassuring to her. She was able to talk with an attorney, and she was able to make an appointment to get her ducks in a row for medical directives and power of attorney. She was able to meet with DSS, Department of Social Services, an adult services worker, and she was able to make appointments to make an appointment to find out about benefits and that she might be eligible for, that her mom might be eligible for. At the training, she was also able to speak with somebody from the Area Agency on Aging and learn about case management and get her mom connected to other resources. Unfortunately, after a few months, Kathy's mom, she was a bit unstable. She had a fall. Fortunately, she did not break anything, but she did need medical follow-up and she needed physical therapy. However, driving her mother to all of the appointments was really taking a lot of time from Kathy's work, and she was getting stressed out about, missing time from work and her job. Her mother's case manager, though, was able to connect her to transportation. And again, this is all of this has to do with the impact of the coordination of services and the development of new services like volunteer transportation options in our district that didn't occur before. After her mother recovered from her fall, Kathy noticed that she was much more withdrawn than she had been, and she was sleeping a lot and spending a lot of time in her room. And she then found out after attending a caregiver support group, which again, we did not have really any of those 20 years ago in the region. But through her caregiver support group, she found out about the senior center. And now Bonnie attends the senior center 3 days a week, and she's made friends and she's more active. And of course, with many senior centers, uh, a lot of the openings have been limited. The what they can offer has been limited due to the lockdowns. Hopefully, we're starting to see things open up a little bit more now. Um, and I know our senior centers at our area agency on aging are beginning to open up again on a limited, safe basis with distancing and masking. So, what are some new initiatives and where are we going in the future? Well, right now, Aging Together we're seeking some funding to be able to implement several new strategies. One is training and innovative training and support to caregivers, both family caregivers and home care providers and agency staff, facility staff, and we're looking at training them in the Time Slips program, which is an evidence-based storytelling program, the Music and Memory program, which those of you who have seen the video clip on Henry know the impact of music, particularly for people with dementia, and the Connections program, which is an activity engagement program. We're working with George Mason University to get caregivers trained on these evidence-based programs. We're very excited about that. It hasn't started yet. We're still seeking funds and hope to be able to launch this summer, in fact. We're also, after attending the wonderful presentation from Center on Aging and other partners on behavioral health for older adults, we are hoping to incorporate two of the evidence-based models, Healthy Ideas and RAP, for our AAA to be hosting those. Again, we're seeking funding to be able to train the aging workers in that. Again, hoping to start that this summer with any luck. And then we're also looking at a new model that has worked very well with feeding children and access to food for children that we're hoping to do through FISH of Fauquier County and the Department of Social Services in getting food to older adults, and particularly isolated older adults in our very rural area. So some exciting initiatives coming down the pike. Where, you might ask, do we get our funding from? Well, here's a little chart. The majority of our funds come from the PATH Foundation, which is located out of Fauquier County in Warrenton, Virginia. We also still rely on our county support and government agencies, and also individual contributions and grants. The royal we, I do a lot of grant writing for the organization. I've tried to list some of our partners, but the list it's really endless, but you can get an idea here. We continue to have our partners. I think something that's really been key and I'd like to highlight is, how do you keep volunteers engaged and active? Well, The representatives from all of these different types of providers and agencies, they come together and they sit around the table and they're driving the conversation. And I think that's really key. I often say to them, "Hey, this is your meeting. This is this is your team. So what are the needs that you're seeing in your county? And what are your ideas for coming up with solutions?" And I think giving them that power, empowering them to make decisions, to drive the conversation, really helps to keep them engaged. And that's what makes Aging Together tick. Our mission, Aging Together through partnerships, connects people to communities and resources to improve quality of life as we age. And that is really what we're all about. We are about getting the supports and services and meeting the preferences of older adults in our region, knowing how many older adults actually do live in our region now. Our vision is for age-friendly communities that actively engage, support, and value older adults. And I want to thank you so much for joining me today, and I really look forward to hearing your questions. Thank you again to Leading Age, and have a great rest of your conference.